Hello, my name is Justin Overstreet, and today I'm going to be talking about chlamydia. In this microbiology course, we have discussed many pathogens and the ways they interact with the human body. This is important, and discussing chlamydia is important because its rise in prevalence in the United States. Chlamydia is the most frequently reported bacterial sexually transmitted infection in the United States. As we can see in the graph, the gray line represents the women and the darker line represents men in a study of 100,000 people in a population and their prevalence of chlamydia. It appears that women have slightly more prevalence in contracting this disease. According to the CDC, an estimated 2.86 million infections occur annually. This is a bacterial infection caused by Chlamydia trachomatis and negatively affects the reproductive system, along with other areas of the human body, including those pertaining to vision, as we will discuss in future slides. Alright, now we'll discuss the pathogen and virulence factors of Chlamydia trachomatis. This is an obligate intracellular parasite that contains gram-negative cell wall. How it works: once inside the host, chlamydia binds to sialic acid receptors found in mucus-rich areas. This is important because, as we described earlier, it's a sexually transmitted disease, and in these areas where this activity occurs are very rich in mucous membranes. Also, as we'll see in the forms of conjunctivitis that chlamydia can impact, there are a lot of mucous membranes in these areas too, around the eyes. It's important to note as healthcare providers that lactam antibiotics such as penicillin that are commonly used to treat sexually transmitted disease in this case are not as effective due to the fact that chlamydia does not contain muramic acid in its cell wall. Lactam antibiotics look to target the cell walls of these microbes, and in this case, we're making them less effective because of this. Next, we will discuss the two life stages. There's the elementary bodies and reticulate bodies. Elementary bodies are important because it keeps the pathogen alive during phagocytosis, and it is seen when it encounters and is taken up by the host in this process. The reticulate body is transitioned into by the secretion of glycogen, and this occurs after phagolysosome has stopped. It's important to note that Chlamydia trachomatis is dependent on the host for energy. It cannot produce its own ATP. This occurs by forming straw-like structures into the host cytoplasm and dividing in binary fission. The reticulate bodies gather energy in this way. 100 to 1,000 reticulate bodies are produced per phagolysosome. Next, we will discuss some of the ways this disease negatively impacts the human body. This disease compromises 3 human biophores. Blindness, trachoma, is seen in many ways throughout the world, but right now it's having a huge impact on the continent of Africa, and chlamydia is the leading cause of this. Next, lymphogranuloma, venereum, is seen to impact more of the rectal area and is seen in gay men in first world countries. Seems to be very prevalent with these factors. Next, serovar Z decay, seen in men and women, and this is a very common form. In men, we can experience epididymitis, which is a infection that inflames the coiled tube located beside each testicle. This is seen in fever, scrotal pain, and swelling. In women, PID, or pelvic inflammatory disease, occurs in 1 in 5 women with chlamydia. This is an infection of the uterus and fallopian tubes. Also, undiagnosed chlamydia can create infertility and EP. Also, it affects newborns, which is seen in neonatal conjunctivitis and neonatal pneumonia, which is important reason why parents need to be screened in order so their offspring does not have to live life undiagnosed with chlamydia. Next, how it's transmitted. This is a sexually transmitted disease, and it can also be passed to newborns at birth. Going back up, I think it's important to note in these two pictures, 5 in 10 men have no symptoms of chlamydia, and 7 in 10 women have no symptoms of chlamydia. As you can see, it's important to be screened because a lot of times people don't even realize that they have this disease, which impacts newborns and impacts the person that's contracted this in negative ways, because undiagnosed can occur, and many things can occur, such as degradation of reproductive organs in both men and women. Here it's stated again that 75% of women are asymptomatic. Also, another fact that we should note is 10 to 20% of people do not contract this disease from one episode. Despite this low occurrence, it's important to stay vigilant. Signs and symptoms. For women, abnormal vaginal discharge, burning sensation while urinating, nausea, fever, and in this case, an example of a symptom would be back pain. The patient could describe lower back pain, and we can't really see this, but they can describe it as a sensation. And the sign can be seen in a fever. The doctor can see this, and also abnormal vaginal discharge is a sign. For men, abnormal penile discharge, burning sensation while urinating, and itching around the sexual organs. Diagnosing this disease, it has been seen that NATTS, or nucleic acid amplification tests, are the most effective, and they're carried out by cervical or vaginal swabs in women and urinal or urethral swabs in men. Studies show that past tests of cultural or enzyme immunoassays are less effective than the NAAT that they use now. It's also important to note that for women, they can test positive and be only passively infected because sperm can be recovered in the genital area up to 7 days following the sexual intercourse. For treatment and prevention, the infection can be treated with antibiotics such as azithromycin or doxycycline, and this is how chlamydia is treated once it has been contracted. But good ways to prevent it are, of course, condoms and protection of this nature, and avoiding multiple sexual partners as prescribed by the Mayo Clinic. And lastly, importantly, get screened, because this is important for both active sexual partners to be aware of their medical condition, if there is one, and also for newborns, because studies show improved prenatal screening and the administration of the proper treatments and intervention in this time is important for the newborn children to have a chance at fighting this pretty early on and not sustain any lasting impacts due to situations they're born into. And so for these reasons, it's important to be screened. This concludes my presentation of chlamydia for the summer 2018 microbiology course at Denver Community College. Thank you.